भारतीय पुनर्वास परिषद की ओर से आज की टेलीकॉन्फ्रेंस में मैं आप सभी का स्वागत करती हूँ। 2 महीने के अंतराल के बाद आज हमने फिर से अपनी टेलीकॉन्फ्रेंस की श्रृंखला शुरू की है। हमारी पिछली टेलीकॉन्फ्रेंस जो 26 अप्रैल को हुई थी, उसमें हमने बात की थी हियरिंग इम्पेयर्ड बच्चों के लिए क्या बेस्ट प्रैक्टिसेस है, उनकी टीचिंग के लिए कौन सी बेस्ट प्रैक्टिसेस को अपनाया जा सकता है। इसी कड़ी को आगे बढ़ाते हुए आज हम बात करेंगे कि हियरिंग इम्पेयर्ड बच्चों के स्पीच एंड लैंग्वेज का असेसमेंट किस तरह से किया जाए। असेसमेंट इज़ द मोस्ट इम्पॉर्टेंट पार्ट in the rehabilitation of a children with hearing impairment, and it is the first step. If the assessment is proper, then the rehabilitation will automatically follow. Today we have two very eminent experts with us to talk on the assessment aspects of children with hearing impairment. I have with me Dr. Asha Dalvi and Mrs. Usha Dalvi. She is a lecturer in Department of Speech Language Pathology of Ali Yavar Jung National Institute of Hearing Handicapped. She is working in this area for last 30 years. She has contributed more than 20 papers in various journals and conferences. She has developed articulation and language tests in Hindi, Marathi and Gujarati in collaboration with RRTC Chennai, which was funded by UNICEF. Our other expert is Ms. Sadhana A. Relekar. She is a lecturer in Speech Language Pathology Department of Ali Yavar Jung National Institute for Hearing Handicapped. She has been working with the institute for last 21 years. She has been actively involved in writing the manuals and booklets on hearing impairment, and both of them are developing a booklet for facilitating learning of Hindi for children with hearing impairment and other disorders. This project is funded by Science and Technology Mission Mode. They both have contributed many other chapters and manuals. आप दोनों का स्टूडियो में स्वागत है। कार्यक्रम को आगे बढ़ाने से पहले मैं आपको स्टूडियो के नंबर नोट करा दूं। हमारा STD नंबर है 011-295-32844, 295-32845। एक और नंबर है 295-36131। फैक्स नंबर है 011-295-36134। हमारा टोल फ्री नंबर है 1800112345। I would request the viewers to ask their questions after we finish the presentation. Mrs. Usha Dalvi, how can we know that the child is having problem in learning speech? Can you tell our viewers?
Yes. If we have to know whether this child has delayed speech and language or disorders of speech, we have to compare the child with the normal development. There is a typical pattern which all the children follow in their first year and which are known as milestones because they occur specifically during those periods. So here I will just briefly tell you about the speech and language development of these children up to say 8 years. So from 0 to 3 months we can see that these children mostly have vocalization which comprises of crying, cooing, gurgling and other types of sounds. Crying is predominant during the first month and later on followed by cooing, gurgling. This is followed by babbling, in which there is a string of consonants and vowels. So the child goes on repeating these sounds, like say for example ba ba ba, aga ga ga and other combinations. And at the later stage, say around 6 to 7 months, these sounds the child uses for even communication purpose, and these combinations are in more numbers, more in duration, with varied intonation and loudness patterns. So, by 8 to 12 months, what we see is the inflected vocal play. In inflected vocal play, the child seems to tell us something, but there is no actual word which is resembling the words which we speak in our day to day life. In inflected vocal play, the child uses again a large number of combinations of consonants and vowels, and again the duration is increased. There is a change in the loudness pattern, pitch pattern, and we also see that the child is more and more or often tries to imitate what the adult says. So this we call it as echolalia, where the child imitates what the adults are saying. And echolalia should say stop by the age of 1 year, and this stage predominantly is also known as jargon stage. By 1 to 1.5 years, the child actually starts using meaningful words. Initially, it may be just 1 or 2 months, and within 6 months, we find that the child is speaking more and more meaningful words. By 2 years, what happens is the child, now his comprehension is increased. The child starts to understand the names of familiar objects, family members, follow simple commands, and also tries to locate people. In expression, generally the child is showing intent, such as refusal. Like if the parents say something, the child may not have meaningful words, but just say ooh, and he is indicating refusal, while the child may just say ma, and then he is requesting for attention, or he may be requesting for any other objects. By 2 years, the comprehension increases, and also in his expression we can see that the child is using 1 to 2 word phrases. This phrases may be combination of say two nouns, that is mama, water, or the child may also be using noun and the verb, that is mama, give, or sometimes the child may say no, water. So you will see that during this stage there is more phrases, and the child at the end of 2 years starts using simple sentences. And by 3 years he uses complete sentences. His expressive vocabulary has increased from 200 to 300 words, and he has developed simple sounds like p, m, b, and all these. By 4 years, the vocabulary is approximately 1500 to 1600 words, which includes not only the nouns, names of objects and all, but it also has vowels, it has prepositions, it has names of various categories like fruits, vegetables, furnitures, etc. Here the child is also able to categorize various things as per their characteristics. He is able to count up to 5, and we also see that there is a role play. For example, like if we give a doll to the child may just pretend that the child is feeding the doll and tries to repeat whatever the mother is trying to say. So this also can be found during this period. And you also see that some of these children, they have this cooperative play where the child is playing with the other child without any quarrel or without any displeasure, and he or she is able to say simple stories, or if you ask them to narrate some small incidents, he is again able to do that. Here again there is a more increase of sounds like d, b, g, all different sounds are there, and also like r, l, sh. By 5 years the child has acquired also time concept of recent and the past. Like for example, if we ask them what did you do yesterday, he will be able to tell that. Or if we say what will you do tomorrow or where shall we go, he will be able to say that. And by this period now the child has acquired most of the syntactic structures or what we call as grammatical structures. Here the child is able to use various tenses, plurals, case markers, also different types of sentences like affirmative sentence, questions, and also using many more types of WH questions. His vocabulary increases approximately to about 2200 words, and by 6 to 8 years all the basic syntax, semantics, and pragmatic skills are acquired. The child is comfortably able to communicate, narrate, or carry on the conversation without any failure or difficulty. So, here briefly we saw how the speech and the language characteristic, speech and language develop in a normal child.
उषा जी ने हमें बताया कि किस तरह से बच्चे की स्पीच का विकास होता है। वो बचपन में शुरू करता है, बाबा से बोलना शुरू करता है और 3 साल की उम्र तक आते आते बच्चा पूरा वाक्य बोलने लगता है और उसकी जो वोकेबलरी है उसमें 200 से 300 शब्द आ जाते हैं। धीरे धीरे उसकी वोकेबलरी बढ़ने लगती है, वह ग्रामर को समझने लगता है और 6 से 8 साल तक की उम्र में बच्चा सभी प्रकार की व्याकरण या सभी प्रकार के शब्दों को समझने और बोलने लगता है। यह तो रहा हमारा भाषा का विकास किस तरह रहा। अब हम जानते हैं साधना जी से कि स्पीच प्रोडक्शन में कौन कौन से सिस्टम्स इन्वॉल्व होते हैं। साधना जी, कैन यू टेल आवर व्यूअर्स?
See, speech production is itself a very coordinated process, and in which you need to have all the functions work in a proper way, where you have respiratory system, जिसमें हम कहते हैं कि respiratory system हमें power देता है. So it starts with the power. So you breathe in and you breathe out. So when we speak, when we breathe out, so respiratory system gives you the power. Phonatory, this air, exhaling air, which goes from the respiratory system, we have two vocal folds, and these vocal folds start vibrating and they make a sound. This sound travels to the oral cavity, and oral cavity, in oral cavity we make lots of sounds, because this outcoming air is interrupted and modified to make the vowels and consonants. We have resonatory system which gives the resonance to our which we can say which gives us a proper quality of our voice. And above all, since we have said that it is a regulatory system which controls all this, so basically all these systems need to work in fine coordination. Only then that we will be in a position to speak properly. Now when we talk of somebody where we say that so and so speech is not really very good or maybe not very normal, we are actually हम उसके निकष लगा रहे हैं किसी normal से. So within normal, when we call as normal speech, it is something that we are talking of voice, we are talking of articulation, we are talking of suprasegmentals, and we are talking of fluency. Now let's see what it means. When we are talking about somebody's voice, we are actually trying to see how is his pitch. Now pitch, when we talk, females have a higher pitch and males have a lower pitch. Now if a person talks, a boy or maybe a man talks with a higher pitch, we say no, his voice is not good. So that means this is one of the aspect of speech that we are talking about, that if he speaks in a female voice, it is this pitch aspect that we are talking about. When we are talking, we also need another parameter of voice, which is loudness. Loudness is something that it has to be very, very appropriate to the situation. So when I'm talking to one person, I have to talk in a less loud voice. When I'm addressing the whole 50 audience, 50 people, then I need to increase my loudness. So it has to be, my loudness of my speech has to be according to the situation that I am talking in, and the quality, which gives us the identity. So quality can be harsh voice, hoarse voice, nasal voice, like this, which then when we are talking of voice, we are actually trying to see pitch, loudness, and quality. Then comes the articulatory aspect of speech, which is the production of different vowels and consonants and the blends. The There's another aspect, third aspect, which is suprasegmental aspect. When we are talking, it actually gives the additional information. It's like how I am speaking. Many a times that we talk, we say, "How did you speak?" And that's the reason that I did not want to do this work. So it is an additional information which is lying on the our message. So that is something that we need to assess. So these aspects are phrasing. It's like we don't talk word by word, we group our words. So this is called as phrasing. Intonations. I need to use different intonation patterns in order to utter a, like if I'm saying asking a question, I need to have a rising intonation pattern. When I'm saying I'm ordering, I have to be very firm. So it has to come in my message that what is my intent, and that is what is intonation. Pauses. Pauses are very important because it specifies where the message has completed. And rate. The rate of speech should not be very fast and or slow. So it should be a medium pace. And the fluency. Fluency is like I should not be repeating too much, or maybe the message, the speech. Now presently I am not very fluent. So this is something that there are breaks. So the fluency part of it, that it is the ongoing message has to be fluent enough. Now when we are talking about hearing impaired children, it is this that we need to assess. The problems in breath control, the problems in voice, their problems in articulation, and they have the problems in suprasegmentals. Here I would like to show you the speech of the hearing impaired.
Good. Good.
We are talking with, you've just heard these three samples of the speech, and we can see that they are talking with short breath. They are talking with, there is one who talks in high pitch, and there is the first boy talks in a higher pitch, and the other two are talking in lower pitch, and they are also talking in taking in breath as and when they require. So there's not much of breath control that you can see. There are articulation problems. The message is not very clear, so the intelligibility is also getting affected. So that is where if the phrasing is not good, then we may have the problem which more deals with the intelligibility of speech.
साधना जी ने जैसे हमें बताया कि हमें आवाज़ को जब हम असेस करते हैं, हमें ये देखना ज़रूरी है कि फ्रेजिंग किस तरह से की गई है, फ्लुएंसी क्या है, आर्टिकुलेशन किस तरह से किया गया है। बहुत सारी चीज़ें हैं, इन चीज़ों को देखने के बाद ही हम ये जान सकते हैं कि बच्चे की आवाज़ का असेसमेंट कैसे किया जाए, क्या समस्या है। अब आइए अब हम जानते हैं कि हाउ कैन वी असेस स्पीच। उषा जी, कैन यू टेल अस?
Yeah. There is a protocol which one has to roughly follow it when we are doing the speech assessment. जैसे अभी साधना जी ने बताया था कि कौन से प्रॉब्लम्स ए बच्चे में होते हैं, तो उसे हमें सिस्टमैटिकली असेस करना चाहिए। और ये असेसमेंट की क्या ज़रूरत है? यूजुअली दिस असेसमेंट हेल्प्स अस to know the base level functioning of the child, that is how much, what is his present level of speaking, what are the misarticulations, whether the suprasegmental is affected or not. So it tells us about the base level functioning. It also tells us, or it helps us to plan the corrective measures depending on his base level. We may decide, okay, first we have to improve his articulation, or whether we have to improve his voice. So it will help us in planning the corrective measures, and also to know whether the progress is there or not, because we may be giving therapy but some children may not improve. It may be so many reasons, but it will help us to know the progress. Now let us see what do we do during assessment. So first and foremost, we have to assess the oral structures. As you are all aware, the oral structures are the main structures which help us in producing different types of sounds, and the oral structures are also known as oroperipheral mechanism. So here we are going to see whether these lips, tongue, teeth, palate, jaw, their structure is normal and whether it is functioning adequately. So the child, we may just ask the child to say, if I am testing lips, I may just look the symmetry of the lips. I may ask the child to pucker the lips, ask him to say ooh, so that whether he is able to do that, whether there is appropriate roundness. I may ask him to say e, so whether there is a appropriate retraction of the lips or not. So that is how I check with the structure of the lips. And if I want to see whether these lips are functioning adequately, I may just ask him to say repeat pa 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 as quickly as he can. Sometimes what happens is these children, even though their structure are normal, but when they say pa 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 pa, they may just say pa 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 pa. So there may be lot of variation. The structure is normal, but the function may be affected. So in the same way, we'll have to check about the tongue, and as we all know, with the help of the tongue, we produce almost 2/3 of the sounds, say consonants and vowels, and also teeth, palate, because sometimes if there is a cleft in the palate, what happens is the voice may get affected, the resonance will get affected, hence the child may have hypernasal voice. And then jaw, which is very important, because to raise, even to elevate the tongue and all that, there has to be a appropriate jaw movement. Followed by this, we'll be checking the respiratory control of the child. Respiration, like Ms. Relekar told us, is very important, because the speech, either the voice or articulation or suprasegmental may get affected if there is no control over respiration. Because sometimes if he is not able to say build up adequate pressure while saying cat. So what happens? It will be sound like cat. The t gets omitted. Hence, there is a misarticulation error. Or sometimes, if he is not able to control even before he says the sound, the air escapes, and then there may be some addition errors. So, this way we have to check with the respiratory control. This is followed by articulation. So, articulation assessment. All these assessment we can do either informally or formally. So here one has to have the knowledge of what all the sounds present in that particular language, and we will be assessing whether the child is able to say the consonants, vowels and blends correctly. So again, these vowels, consonants, their place of occurrence are different. Sometimes a consonant may occur in the initial word position, medial word position and final word position. So all these knowledge is very important, and we have to check whether the child is able to say that particular sound in a different word positions and also in a spontaneous speech. So articulation has to be assessed at word level and also at the spontaneous speech level or in the sentence level. And the blends which are little difficult like pl, gr, tr and all those. So blends also many of these children find it very difficult. So blends should be evaluated. This has to be followed by voice assessment. Here we may just ask the child to say ah continuously. Say we tell the child, okay, you prolong the vowel saying ah as long as you can say, and this will tell us whether the child is able to have that control, whether he is able to have pitch control. Apart from pitch control, whether pitch is high or low and whether it is age and sex appropriate. The same way we have to check the loudness. So when he is speaking, and it has been seen that many of these children have poor control over loudness. Suddenly they will speak in a loud voice, suddenly the loudness reduces. So loudness control assessment also is important. And quality, because what happens is they are little apprehensive about how they are talking, and hence there is a tension. Because of the tension, what happens is the quality of their voice sounds very strained, and sometimes they do not get the appropriate model, they are not able to hear the sounds correctly, hence there may be difference in the quality. Sometimes it sounds hyper nasal also. So the voice can be assessed just asking them to say ah, or it can be also seen in their spontaneous speech, or you may ask the child to read if he is able to read that, which will tell us about his voice aspect. Then we have to assess the suprasegmentals. Suprasegmentals, again it has been found and it was mentioned by Ms. Relekar that in suprasegmental many of these children try to speak word by word, and then because they have poor respiratory control, what happens is their pausing is not correct, and hence everything sounds very monotonous. Hence here, while assessing suprasegmentals, we have to either give them some written text which can be simple sentences or it can be a passage which will give us a very clear idea about whether the child is using raising intonation, whether he is using appropriate pauses, or whether he is giving correct stress. Of course, above all, even just assessing their oral structures, voice, articulation is not enough, because whatever they are speaking, whether it is intelligible or not is very important, because altogether gives intelligibility to the speaker, and whether the other person is able to understand his or her speech becomes a important aspect. So here we have to check whether the child, whatever he is speaking, can be understood without any repetition, or whether the child needs to have one more repetition, or the person cannot understand even in spite of knowing the context. So intelligibility is a very important aspect. Just assessing articulation, voice, suprasegmental is not adequate.
उषा जी ने हमें बताया कि जब हम बच्चे की आवाज़ का असेसमेंट करते हैं तो उसमें हम कई चीज़ों की जांच करते हैं। उसमें ये देखते हैं कि ओरली बच्चे के होठ, जीभ, दांत, जबड़े की संरचना और उसके जो फंक्शन है क्या वो ठीक हैं। इसके अलावा बच्चे हम ये भी देखते हैं कि क्या बच्चा ठीक से आर्टिकुलेट कर पा रहा है, आवाज़ की पिच कैसी है, तेज़ी है, आवाज़ की क्वालिटी कैसी है। इन सब चीज़ों की जांच की जाती है। इसके अलावा एक चीज़ जो बहुत इम्पॉर्टेंट है वो ये जानना ज़रूरी है कि क्या बच्चा जो बोल रहा है उसे सुनने वाले की समझ में आया या नहीं। क्योंकि अगर बच्चा आर्टिकुलेट कर रहा है और समझने वाले ने नहीं समझा तो आवाज़ का इसका मतलब है जो कम्युनिकेट किया जा रहा है वो ठीक तरीके से नहीं हो रहा है। तो ये जो बहुत ही इम्पॉर्टेंट एस्पेक्ट इसमें है। तो अब मैं उषा जी से ये पूछना चाहूँगी कि व्हाट आर द कंपोनेंट्स ऑफ लैंग्वेज दैट नीड्स टू बी असेस्ड।
Yes, as we know, language can be verbal or non-verbal. The non-verbal language is sign language, and also maybe written language, while the spoken language is generally we give more emphasis on. But whichever mode of communication the child is using, whether the child is using sign language or spoken language, we have to assess whether he is using appropriate semantics, syntax, or pragmatics. In semantics, these are some of the general principles or some of the general items which one should keep it in mind while assessing language. So in semantics, we will see whether the child is having enough vocabulary, because vocabulary is not just the child saying names of people, names of items, names of objects, but vocabulary should be rich. Rich in the sense it has to have both the quality of the vocabulary and the quantity of the vocabulary should be adequate. When I say quality, it includes the child's vocabulary should consist of names of objects, verbs, then also say fruits, vegetables, actions, and various other categories. Then the child should also be able to say or understand the opposites, synonyms, like one word may have two different meanings, and in what context it is different or in what context it can be used. In syntax, we look at the grammatical structures of the language, that is, whether the child is able to say tenses correctly, plurals, case markers, etc. And in pragmatics, we are looking at whether the child is able to use whatever sentences, structures, vocabulary he has in a meaningful way, and while conversing whether he is able to maintain a topic, whether he is able to have topic initiation, turn taking, and also the narrative skills. All these language aspects we have to assess both in receptive and expressive area, because receptive, only when the child understands what it is he will be able to express meaningfully. So language has to be assessed both receptive and expressive. In receptive language, generally what we do is, like if you want to assess a specific say item like tenses, then first to see whether he has understood or not, maybe you can present certain pictures which will elicit those specific items. So here we may just ask the child, okay, look at this picture and tell me what is the boy doing. So the child, if he has, sorry, I will show the picture and I'll ask him show me where the boy is climbing the tree. So if the child is able to point the correct picture, then we can understand that he has comprehended. But if he is not able to point out, then it tells us that the child has not understood or his comprehension is poor. In the same way, when we are assessing the expressive language, what we are doing is either we can use some standardized test, or we can also use some of the other test material. Like here, for example, if I am again going to test the tenses, what I may do is I may keep three pictures of different tenses, and I will ask him to say, can you please look at this picture and tell me what is happening? So the child has to look at the picture and describe the picture, and while he is describing, I have to note down whether he has used appropriate tense which is being showed in the picture. So both receptive and expressive language has to be evaluated using different materials which is available.
उषा जी ने हमें बताया कि भाषा का असेसमेंट, लैंग्वेज का असेसमेंट करते वक्त हमें दो बातों का ध्यान रखना चाहिए। एक तो है कि बच्चा भाषा को कितना समझ रहा है और कितना उस भाषा को एक्सप्रेस कर पा रहा है। हमें ये जानने के लिए बहुत सारे टेस्ट हैं, बहुत सारे तरीके हैं जिनके माध्यम से हम जान सकते हैं। बच्चे को कोई तस्वीर दिखाकर हम उससे पूछ सकते हैं कि क्या इसमें क्या किया जा रहा है, या कोई भी सवाल इस तरह से हम पूछ सकते हैं। अब हम पूछते हैं साधना जी से कि व्हाट ऑल वी शुड कीप इन माइंड व्हाइल असेसिंग द चिल्ड्रन विद हियरिंग इम्पेयरमेंट।
For any assessment, we must try to see that we get the attention of the and the cooperation of the child. Make sure that the environment is quiet and congenial. Give clear instructions so that there is no misunderstanding of what you want the child to do. And while you are selecting the pictures or the test material, you must select the material which is age appropriate. And you should also you should also train the parents to be more observant about the child, because there are times when the child does not really perform at his best. So in that case, in the test environment, so you must try to train up the parents so that they are observant, because it's a natural setting for the parent, for the child, so that he is not tested. So he is as normal as how other children are. So you must, and that would help if the parents are trained up to observe all these things. So then it will help us to get better idea of the child.
साधना जी जिस तरह से बता रही थी कि असेसमेंट के वक्त ये बहुत ज़रूरी है कि हम जिस बच्चे का असेसमेंट कर रहे हैं उसका कॉपरेशन लिया जाए, उस बच्चे के ऊपर एक प्रेशर ना हो कि हाँ मेरा असेसमेंट किया जा रहा है। उस तरह के माहौल में न कर कर बच्चे का सपोर्ट लेना, पेरेंट्स का सपोर्ट लेना, और जो असेसमेंट हम कर रहे हैं वो बच्चे की एज अप्रोप्रिएटनेस के साथ भी किया जाए। तो इन सब चीज़ों का हमें ध्यान रखना ज़रूरी है। अब मैं उषा जी से पूछती हूँ कि वो हमें ये बताएं कि व्हाट इज़ द रिलेशन बिटवीन हियरिंग एंड स्पीकिंग? इज़ देयर एनी रिलेशन बिटवीन दैट?
Yes, definitely there is a relation between hearing and speaking, because we know if I am in a crowded place and if I can't hear, I am not able to answer properly. So hearing, in the same way, in a very young child, for the child to acquire language, listening is very, very important. The child has to hear different sounds, he has to hear the language spoken is in his environment. And speaking and hearing, it is like a chain, what we call a speech chain, where there is a speaker, there is a listener. When the speaker utters a word, what happens is this is carried through the medium of air and it is heard by the listener. And the listener, he tries to understand what the person has asked or what am I supposed to do. So he is trying to understand and then he is replying that. So here what happens is during the speech process, there has to be definitely a chain of listening and then expressing. And also, when we say or when I am replying, what happens is I am also listening whether what I have uttered is correct or not. So it helps me to correct my speech if there is any mistake. So listening is a very, very important aspect. That is, through listening only we are able to understand. It is not just by hearing. Hearing is just perception of a sound, but listening is I have to understand what I have heard. So there is a very close relationship between hearing and speech.
Yeah, thank you, Usha ji. Sadhna, can you show us some of the films? Yeah, just hold, yeah, just give the call. Hello. Uh, Please transfer the call. I think it is disconnected. We can. Karen, can you show us some films?
Hello.
Hello.
Hel-
Please
Madam,
ask
I am
your
calling
question.
from Chennai. I am Darshini.
Yes.
I am working in Balavihar.
Yes.
This is a question regarding assessment, ma'am.
Yes.
How do you assess speech intelligibility of a child?
Okay.
Thank you.
Okay. Yeah. Can you answer the question
Yeah.
right now?
Yes. For assessing speech intelligibility, there are certain rating scales. Actually, the rating scales are available or they have been developed by uh, RINTD, and also intelligibility scale is developed by AYJ NIHH, which is a 7-point scale, while RINTD scale is 5-point scale, where it ranges from 0 to 6. This is I am telling you about the 7-point scale which is developed by AYJ NIHH. So it has 7 ratings. The 0 rating is the normal speech, and rating 6 is the speech which is not at all understood by anyone, even in spite of the context known. So we have to use certain rating scales to assess the intelligibility. Or sometimes what they do is, you can have, if those rating scales are not available, you can select say 10 words, ask the child to repeat, and somebody has to note down that, and you see whether it is understood or not. This becomes little subjective, but still we can rate the intelligibility of the speech.
Yeah. Sadhna, can you show us some assessment?
Yeah, we have some clips here.
Some clippings.
वेरी गुड. और एक बार. गुड. शाबाश. गुड.
Side la.
साइड में कीजिए. हाँ. और अभी जैसे पापा पापा बोला था ना, वैसे टा 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 टा. वेरी गुड. और एक बार. हाँ.
In this, we are assessing the comprehension informally.
अभी आप क्या कर रहे हो?
अभी मैं पढ़ाई कर रहा हूँ.
गुड. कल कितने बजे स्कूल जाओगे?
कल मैं 7:30 बजे गया था.
कल देख के मुझे बताइए क्या हो रहा है.
Some 3 pictures and the child has to express.
लड़की क्या करेगी?
लड़की बेच गई वाली है.
करने वाली है, गुड। और इधर
लड़की बेच गई है।
वेरी गुड। और इधर
लड़की बेच कर चुकी है।
वेरी गुड।
This is a clip of some articulation assessment. Has to say the word and then how he is saying that has been assessed.
पेड़ा या लड्डू?
लड्डू।
ठठेरा।
ठठेरा।
क्या बोलते हैं इसको? अंगूठा।
अंगूठा।
होठ।
होठ।
Sadhna, can you tell us what is the relevance of good communication skills?
Good communication skill is very, very important. With now that Sarva Shiksha Abhiyan, which has come, where more and more children are getting the opportunity to get education in mainstream. So that is where that he has to have good communication skills so that all others can understand. And communication skill is not just the speech; it is how effectively can he communicate his ideas and his demands and everything. So that is what it is very, very important that the child, not only that we should give importance to speech, but if the child does not have the speech, there is lot that we can assess is his non-verbal communication, which is maybe if he's communicating with the gestures, or maybe he's communicating with the sign language, or with the written communication. So that is what is very, very important.
Can I add one point,
Yeah.
madam? So it is not only how effectively the child is going to communicate, but it also has a larger impact, because if the child is able to communicate effectively, means he is able to acquire good education, and also he is able to maintain a good social relationship. And when he is an adult, or he is going for certain jobs, or he is working in some places, definitely for his professional growth also, this communication skills are very, very important. And one has to strive to get that the child is able to communicate effectively. It is not just correct pronunciation, good voice, or correct supra segmentals, but it is a overall effect, that is the communicative effectiveness.
आप दोनों का कहना है कि गुड कम्युनिकेशन स्किल्स का होना बहुत ज़रूरी है सामाजिक विकास के लिए, आगे पढ़ाई के लिए, या रिहेबिलिटेशन के लिए भी ये बहुत ज़रूरी है। इसमें खाली कम्युनिकेशन में स्पीच एंड लैंग्वेज ही नहीं, उसके अलावा हमारे क्या जेस्चर्स हैं, क्या हाव भाव है, इन सब चीज़ों का भी बहुत महत्व होता है। अब मैं उषा जी आपसे ये पूछना चाहूँगी कि कौन से ऐसे कारण हैं जो स्पीच डेवलपमेंट को प्रभावित करते हैं? जो अभी कारण हमने बात की है, इसके अलावा और कौन से कारण हैं?
हाँ, especially hearing impaired children, we know because they are not able to hear, he is not able to speak, and there is a range of speech problems which we had just discussed earlier. And these problems, speech problems range depending on the severity of his hearing loss. So first and foremost in these children is the sensory perceptual problem, and sometimes even in spite of good hearing aid or amplification provided, what happens, some children may not benefit. Then even visual perception, which is very important for learning lip reading skills, also becomes important. So sensory perceptual skill is one of the cause, or it has to be good. And the second one is neuromotor maturation. In neuromotor maturation, what are we looking for is, because they help the child to learn, to quickly say those movements, because speech is basically a motor process, and here the child has to use these motor movements very precisely, correctly, in a coordinated fashion. So what we are looking for is to have this, definitely the regulatory system, what we said, or the neuromotor maturation is very important, because finally speech is an automatic process and it is also the fastest mode of communication. So apart from, say, sensory perceptual skills, neuromotor skill, and then the cognitive skills, because if I have to answer something, I have to recall, whatever is in my memory. So here the cognitive skills to retain, recall, and all, it becomes very important for an individual to learn language. And not only all these, but then what happens is, even good model, we know, okay, the wolf boy story, which is very very famous. The child has oromotor structures normal, the brain structures are normal, everything, but he is not able to learn the language because he is not exposed. So good model is very very important for a child, and along with that it has to be a motivating or a enriching environment, because you can't just go on bombarding the child with speech. You have to give some time for the child to understand, the child to perceive, and also he has to be given time to make choices and also select what he wants to say or not. So there has to be an enriching, motivating environment. So all these factors, apart from, say, just hearing loss, becomes very important in acquiring speech or learning speech and language.
धन्यवाद उषा जी। साधना जी, मैं आपसे ये पूछना चाहूँगी कि हमारे जो प्रोफेशनल्स हैं उनके लिए आप क्या मैसेज देना चाहेंगे?
Usually it is the professionals find that to assess the children with hearing impairment is quite difficult task. I would like to tell them that it's not very difficult task, but it certainly requires lot of skills. It requires first and foremost a good observation skills. So you must develop the good observation skills. One needs to be very very sensitive, and one needs to have the norms, knowledge of norms, so that we are able to compare what is disordered as what we call as compared to the norms. So that is very very important.
थैंक यू साधना जी। उषा जी, आप हमारे प्रोफेशनल्स को क्या संदेश देना चाहेंगे?
I would just add on to one more point, that is, the assessment is not one time process. It should be an ongoing process, and also what we have to do is, like I said, you have to not only focus on just assessing various aspects, but look at the overall effect. So when we are assessing, let it be an holistic process, and it has to be, as and when required, a good referral.
आज हमारे एक्सपर्ट्स ने हमें बताया कि हियरिंग इम्पेयर्ड बच्चों के असेसमेंट के लिए किन किन बातों का ध्यान रखना चाहिए, किस तरह से उनकी भाषा का विकास होता है, किस तरह बचपन की शुरुआत से लेकर 8 वर्ष की उम्र तक आते आते बच्चा एक दो शब्द से लेकर वाक्यों का कॉम्प्रिहेंशन करने लगता है, और यदि बच्चों को हियरिंग प्रॉब्लम है तो उनकी भाषा के विकास में हमें किन बातों का ध्यान रखना चाहिए। यदि आपको इस विषय पर और जानकारी चाहिए तो आप अली यावर जंग नेशनल इंस्टीट्यूट ऑफ हियरिंग हैंडीकैप्ड मुंबई में मिसेस उषा दलवी या साधना रेलेकर से संपर्क कर सकते हैं। इनका एड्रेस स्क्रीन पर दिखाया जा रहा है। फ़ोन नंबर है 26400215, एक्सटेंशन 309, दूसरा एक्सटेंशन है 310 और एक एक्सटेंशन और है 329। आप इनकी वेबसाइट से भी अधिक जानकारी ले सकते हैं। वेबसाइट नंबर है www.ayjnihh.nic.in। Our next teleconference will be held on next Wednesday from 2:30 to 3:30. The topic will be Management of Speech and Language Problems in Children with Hearing Impairment. The experts will be from Ali Yavar Jang National Institute for Hearing Handicap from Mumbai, timing would be the same, and in the end I would say my thanks to the viewers, our experts, and my colleagues of RCI and EMPC. चलते चलते मैं अपने व्यूवर्स को यही कहना चाहूँगी कि सही रिहेबिलिटेशन के लिए ये बहुत आवश्यक है कि प्रॉपर असेसमेंट किया जाए। सही असेसमेंट, सही मैनेजमेंट और रिहेबिलिटेशन के दिशा में एक पहली कड़ी है। इस कड़ी का मजबूत होना बहुत ज़रूरी है। धन्यवाद।